Hi guys, I am Dr. Laine Morales and I am the owner of Pure Light Chiropractic. Here at Pure Light Chiropractic, we focus on pregnant women. So today what I wanted to do was explain to you about the Webster Technique. It's a specific technique that our chiropractors are trained in that will help you hopefully have an easier pregnancy. But what it does is it aligns the pelvis. And so I want to explain to you how that works and then tell you what we do with this technique. It's very gentle. So this is what your spine looks like, and I want to focus on the pelvis. Here's your pelvis. So this is the front of the pelvis, and your baby will hopefully come out through this area here. In order for that to happen, everything in your pelvis kind of opens up and spreads out when you're in labor. So the sacrum, this is your sacrum right here, it will open up and these bones will move out to the side, and this pubic bone will also separate a little bit. And that's what's supposed to happen in order for baby to descend and move into this world. So what can happen with some women is that they might have an area of fixation or an area that is stuck in this system. So that might be this joint, this joint, this joint, this joint, this joint, or this joint, or all of the ligaments that surround the pelvis to hold it together as well, or the muscles. So let's say you have an area of fixation on just this one joint here. What that's going to do is it's going to cause compensation throughout the rest of your pelvis. You'll start overcompensating, and so you might see some torsion in the pelvis or twisting or overuse. So maybe this joint will start to hurt really bad because this one's not moving at all, so then it becomes inflamed and starts moving too much. Whenever all that happens, it will cause this kind of twisting of the pelvis or torsion because the body's trying to compensate for this one fixation. And if the whole pelvis is twisted to one side, then it's going to make it harder for that baby to come out during labor. So what I'm going to do is check your pelvis and get all these joints to start moving correctly, and that will hopefully bring some ease back into the system. And if baby is comfortable, then it may end up being head down because there's more space in there. That's not necessarily the reason why we do Webster Technique, but if the pelvis is functioning correctly, then there's a higher chance that baby will get into a natural position, which tends to be head down for a predominant amount of women. So the way the technique works is that I'm going to assess your sacrum, this area right here. I do it through a very gentle leg check, and then I'll find out, usually there'll be one side that's kind of twisted back, and that will be the area that I adjust. It's a pretty gentle adjustment. You'll be face down on some comfortable pillows, and you can use these pillows. There's a big hole cut out, so you can use the pillows throughout your pregnancy. I've had 42-week mamas on them. And I'll adjust that area. And then we flip you over and we check your round ligaments or your broad ligaments. So these ligaments that connect in here, and they kind of hold the uterus, and they'll start to stretch as the uterus gets bigger. What we often find is that if there's torsion on one side of the pelvis here, then there's going to be some tension on this side of that ligament on the opposite side because of that torsion or that twisting. And so we'll check the opposite side, but I'll obviously check both. And by releasing the tension there, you may feel less round ligament pain or pain in this area. And then hopefully you'll also feel like there's more space or more opening. So that's really the whole premise of Webster Technique. I still assess the entire spine as a chiropractor because I know that tension up here can relate to tension down here. But in general, you'll be getting your sacrum checked and then these ligaments in the front checked. So if you have any questions, call our office, 512-750-1512. And if you're interested, then also just let us know if you have any questions. We'd be happy to answer them.